Hello friends, welcome to NEET PG Live Daily. Myself Dr. Apoorva Mittal and I'm your educator for Anesthesia on this prestigious platform for Unacademy. And today we'll be discussing about the previous year questions part 2 which has been asked in the NEET exams and the other exams. So let's start our today's topic. Friends, am I clear and audible? Am I audible? Friends, just give me a second. Am I audible? Okay. So, saying about the previous year questions part. I'm so sorry. Just give me some problem. Okay, so let's start our today's topic that is upon the previous year questions. But before that, welcome to Unacademy friends, and by getting the Unacademy Plus subscription, you'll be able to avail all the live classes and also interact with the educator. We'll be having daily live polls and the leaderboards and also test series and analysis through which you can assess your progress, and also live doubt clearing sessions through which you can come to know you can clear the doubts from the educators for the 19 subjects. So these are the advantages of the Unacademy Plus subscription, and by getting the Unacademy Plus subscription you can avail it for either 12 months or 24 months. Okay, you can avail it for 24 months or 12 months, and if you apply my code, that is Apoorva Live, APOORVA Live, you can get 10% discount on the same. So these are the advantages of getting the Unacademy Plus subscription. So let's start our today's topic. Guys, am I audible and clear? Because I'm not able to see. Okay, sorry for the spelling mistake. So now, first of all, what will be the first question of today? That is the drug of choice for reversal of neuromuscular blockade by vecuronium. The drug of choice, okay, for reversal of neuromuscular blockade by vecuronium. What it is? Is it A, edrophonium, or B, neostigmine, C, sugammadex, or D, pyridostigmine? What should be the answer for this? The drug of choice. Okay, the drug of choice for neuromuscular blockade by vecuronium. A, edrophonium, B, neostigmine, C, sugammadex, or D, pyridostigmine. What should be the answer for this, friends? Reversal of neuromuscular block by vecuronium. C, vecuronium. If I'll see, it is a vecuronium. Okay? It is a non-depolarizing muscle relaxant. Okay, vecuronium, it is a non-depolarizing muscle relaxant, and non-depolarizing muscle relaxants, they are in turn divided into benzyl isoquinolones. Okay, they are in turn divided into benzyl isoquinolones and also steroids. Okay, so the non-depolarizing muscle relaxants, they are in turn divided into benzyl isoquinolones and steroid. The examples of benzyl isoquinolones are, okay, so benzyl isoquinolones, the example of these are etracurium, okay, cis-etracurium and mivacurium, cis-etra and Mivacurium. See, these are the benzyl isoquinolones. The steroid groups of drug are pancuronium, okay, rhonium, then rocuronium and vecuronium. So what happens, the drug of choice for the neuromuscular blockade for the steroidal group of drug, it is Sugammadex. It is Sugammadex. Why? Because Sugammadex, it is a gamma cyclodextrin. Okay, it is a gamma cyclodextrin. It first selective relaxant binding agent. It is a selective binding agent. It is selective for the steroidal group of non-depolarizing muscle relaxant. What it does is, this is the steroidal group of muscle relaxant. It encapsulates the muscle relaxant, and therefore the action of the muscle relaxant is degraded. The action of the muscle relaxant is degraded. Remember this. It is cardiovascular stable and it does not require anticholinergic administration. What happens with neostigmine? Okay, with neostigmine, which is a acetylcholinesterase inhibitor. Okay, what happens? There is increase in the acetylcholine level, and this acetylcholine, it acts on both muscarinic and nicotinic receptors, and by acting upon the muscarinic receptor, it causes bradycardia, it causes decrease in the heart rate, anticholinergic effect, and therefore we have to give atropine along or glycopyrrolate along with neostigmine while reversing the effect of the skeletal muscle relaxants. But with Sugammadex, there is no need for anticholinergic administration. Is it clear? So this is about the first question, that is the drug of choice for reversal of neuromuscular block by vecuronium, that is Sugammadex. Okay. Now, question 2. Which of the following is a well-known adverse effect of etomidate? Which of the following is a well-known adverse effect of etomidate? Is it A, myoclonus and hiccups, B, increased intracranial tension, C, increased cortisol suppression, okay, increased cortisol suppression, or D, all of the above? What should be the answer for this, friends? Which of the following is a well-known adverse effects of etomidate? It is myoclonus and hiccups, increased intracranial tension, increased cortisol suppression, okay, or all of the above? What should be the answer for this? Etomidate. For etomidate, I am giving you time. Okay, etomidate, what it is? Okay, see, etomidate जो है, it is a IV anesthetic. Okay, etomidate, it is a imidazole derivative and it is a IV inducing agent. Okay, Dr. Kunal is telling me increased cortisol suppression. Dr. Kunal, I'll just tell you, it is not increased cortical suppression, it causes myoclonus and hiccups also. Okay, so I'll just tell you what is etomidate. It is IV induction agent, okay, which is a imidazole derivative. Then yes, if both A and C are the correct option, then yes, it will be D. But listen, remember about etomidate, it is an imidazole derivative. It is milky white liquid, same as propofol. Even propofol is milky white liquid. Okay, and it has, because of its high lipid solubility, therefore rapid onset and brief duration of action is there. What happens is, it is most hemodynamically and cardiostable. Remember this, it is most hemodynamical and cardiostable IV induction agent, therefore drug of choice in cardiac surgeries. It is an agent of choice. Okay, coronary perfusion pressure is also maintained with this. But what is the adverse effect? The adverse effect is it causes superficial thrombophlebitis and pain on injection. Why? It causes pain on injection because of propylene glycol. Okay, remember, it causes pain on injection because of propylene glycol, and more specific is adrenocortical suppression. Why it causes adrenocortical suppression? Because there is what it causes, there is inhibition of beta hydroxylase enzyme. ठीक है, and this beta hydroxylase enzyme, it converts 11-deoxycortisol to cortisol, and as this is inhibited, there is no more formation of the cortisol, and therefore there is cortisol suppression. So the most specific feature of etomidate is this, and the most common अगर पूछा जाए, that is nausea and vomiting, and it can produce hiccups and myoclonus also. So what was our question? Which of the following is a well-known adverse effect of etomidate? Then if it is only asked well-known, because it does not increase the intracranial tension. So yes, Dr. Kunal, as you mentioned earlier, it is C, that is increased cortisol suppression. It causes increased cortisol suppression. Okay, myoclonus and hiccups is also caused by it, but well-known adverse effect, the specific adverse effect, if it is asked, then it is increased cortisol suppression. Is it clear? Is it clear? Dr. Kunal, is it clear? Why is it asked well-known adverse effect? Okay, the most specific adverse effect of etomidate. It can cause myoclonus and hiccups also. Okay, now question number 3, the current recommendation. Question number 3, current recommendation for minimum pre-operative starving period for solid food. What should be the answer for this? Minimum pre-operative starving period for solid food. Is it A, 4 hours, B, 6 hours, C, 10 hours, or D, 8 hours? What should be the answer for this? Solid food के लिए minimum pre-operative starving period, what it is? 4 hours, 6 hours, 10 hours, or 8 hours? Please let me know the answer. Okay, please let me know the question 3 answer. Current recommendation for minimum pre-operative starving period for solid food. What is the answer for this? Okay, time is up. For solid food, what is the minimum pre-operative period? Remember, 2, 4, 6, 8. Okay, 2 hours is for the clear liquid. It is for the clear liquid, that is water, and pulp free juices. ठीक है, like apple juice, that is for 2 hours. For 4 hours it is human milk. ठीक है, breast milk, breastfeeding. ठीक है, that is for 4 hours. But infant formula feeds or non-human milk, you have to wait for 6 hours. Okay, you have to wait for 6 hours. Or if it has light meals mean if you are taking toast with the milk, or if it is very light meal. And for the solid food, for the solid or heavy food, that is 8 hours. So Dr. Kunal, it should be D, that is 8 hours. Okay, for the solid food, if it is asked, then it is 8 hours. If they have specifically mentioned light meal, okay, or infant formula or non-human milk, then it should have been 6 hours. Is it clear? So the answer for this is 8 hours. Okay, yes, as you mentioned, non-veg and fatty food, it is 8 hours. So for solid food, it should be 8 hours. Now coming to question number 4. A patient was undergoing surgical procedure. Okay, a patient was undergoing surgical procedure under general anesthesia. Suddenly, he developed tachycardia, sweating, hypertension, and tachypnea. What is the immediate step to manage the situation? Okay, a patient was undergoing surgical procedure under GA. Suddenly, he developed tachycardia, sweating, hypertension, and tachypnea. What is the immediate step to manage the situation? Is it A, IV beta blocker, B, abandon the surgery, C, deepen the plane of anesthesia, or D, nothing is required? What should be the answer for this? Dr. Kunal, any doubts in the previous question in the pre-operative finding, in the pre-op fasting guidelines? Any doubt in that? I'm asking a patient. If any doubts, please let me know. Please answer this question. A patient was undergoing surgical procedure under GA. Suddenly, he developed tachycardia, sweating, hypertension, and tachypnea. What is the immediate step to manage the situation? IV beta blocker, abandon the surgery, deepen the plane of anesthesia, or nothing is required? What should be the answer for this? What should be the answer for this? Okay, these are the features. Okay, these are the features that suggest that the patient is under light plane of anesthesia. ठीक है, tachycardia, sweating, hypertension, tachypnea, it suggests that the patient is under light plane of anesthesia. So the immediate step, it is deepen the plane of anesthesia. Okay, Dr. Kunal is saying in the question bank, it is given that it is 6 hours, but according to the guidelines, okay, according to the guidelines, it is always for the solid food. Okay, it is 8 hours. Dr. Kunal, according to the guidelines, for the solid food, it is 8 hours. Okay, I'll just in the next class, or I'll just post the guidelines on the group, then it will be clear. According to the guidelines, it is the solid food, it is 8 hours minimum. Okay, for the solid food, it is minimum 8 hours. Is it clear? Is it clear? Okay. Question number 4. As I was telling, a patient was undergoing surgical procedure under GA. Suddenly, he developed tachycardia, sweating, hypertension, and tachypnea. What is the immediate step to manage the situation? So these are the features which are suggestive of the patient is in the light plane of anesthesia, and we should deepen the plane of anesthesia. Okay, we should deepen the plane of anesthesia. Okay, any doubt in this question? I think there is little lag. Okay, I'll wait for you. Just see this question and then answer. The immediate step to manage the situation is you have to deepen the plane of anesthesia. The given patient is showing signs of light anesthesia and intraoperative awareness. So what are the signs of light anesthesia? That is, patient will be tachycardic. Light anesthesia का मतलब क्या हो रहा है? Light anesthesia का मतलब ये हो रहा है कि the anesthetic effect, the amnesia, okay, amnesia, the patient is becoming conscious. Okay, light plane of anesthesia is the patient is becoming conscious. Okay, so the patient, as he is able to perceive the stimulus, therefore he will become tachycardic, okay, hypertensive. There will be lacrimation, perspiration, eye movement. So like you are somewhat awake and there is painful stimulus which is there. So the patient will have tachycardia, hypertension, lacrimation, perspiration, eye movement. preserve reflexes, movement on the painful stimuli, and because the reflexes are preserved, okay, the reflexes are preserved, more chances of laryngospasm, bronchospasm, tachypnea, and also on the EEG we will get beta waves, okay, we will get beta waves on the ECG. So these are the signs for light anesthesia and the intraoperative awareness. Okay, these are the signs. So therefore the answer in this should be deepen the plane of anesthesia. Is it clear? Is it clear? So that is question 4. Any doubts in this question? Any doubts in this question? Now coming to question 5. Features of light anesthesia are all except. Features of light anesthesia are all except. Is it A, desirable in certain high-risk patient? B, patient may feel pain during procedure? C, post-traumatic stress disorder is a complication? Or D, no explicit memory for the event? What should be the answer for this? I am giving you time for this question. Features of light anesthesia are all except. Is it desirable in certain high risk? Patient may feel pain during the procedure. Post-traumatic stress disorder is a complication, or no explicit memory for the event. What should be the answer for this? Please answer this question. Please answer this question. Dr. Kunal. Others also please answer this question. What should be the answer for this? I'm waiting for the answer. Okay, so light plane of anesthesia. Yes, it is desirable in certain high-risk patients. It is desirable in certain cardiac patients, or basically in the obstetric patients. And because the patient is in light plane, the patient may feel pain during the procedure. That is also there. Okay, and as the patient was aware about the events during the procedure, yes, there is post-traumatic stress disorder and no explicit memory. There is explicit memory for the event. So D should be the answer. So features of light anesthesia are all except. Yes, confused between A and D. I told you light plane of anesthesia is desirable in certain high risk patients like cardiac patients, or even in the obstetric patients, because they won't be able to tolerate the anesthetic effects. So therefore we keep them in the light plane of anesthesia. So amongst A and D, B is the best answer. No explicit memory for the event. When the patient is in light plane of anesthesia, he is somewhat conscious, and therefore there will be memory for the event. Is it clear? Is it clear? So according to this, I will just discuss about the 4 stages of anesthesia. It was described by Goodall. Remember, Goodall ne one more thing was introduced, or there is one more thing which is named after Goodall. What it is? Can you tell me? There is one more thing which is named after Goodall. Can you tell me what it is? What it is? There is one more thing named after Goodall. Please tell me what it is. So Goodall, you remember the oropharyngeal airway? Yes, Dr. Kunal, there is some lag. What to do? I'll just I'll just see. So Goodall's it is the oropharyngeal airway. It is the oropharyngeal airway, which was also introduced by Goodall. So remember Goodall, he described 4 stages of anesthesia, and he also introduced the oropharyngeal airway, because of which there is no tongue fall, which prevents the tongue fall against the posterior pharyngeal wall and maintains the patency of the airway. That is the Goodall's airway. ठीक है. So Goodall, he described 4 stages of anesthesia, and these are true only with ether. Remember, the 4 stages of anesthesia which were described by Goodall, these are true only with ether. The first stage, the stage 1, is the stage of analgesia, that is from the anesthetic inhalation till the loss of consciousness, that is stage of analgesia. What is stage 2? That is the stage of delirium or excitement. Oh, you want me to, Dr. Khushi wants me to teach in Hindi, please? Okay, I'll repeat in Hindi also. So Goodall ने 4 stages of anesthesia दिए थे, and these stages of anesthesia, ये जो stages हैं ये सिर्फ और सिर्फ ईथर के साथ के लिए है. स्टेज 1 में है स्टेज ऑफ एनाल्जेसिया. जब हम लोगों ने एनेस्थेटिक इनहेलेशन दिया उस तक there is loss of consciousness. Okay, stage 2 is stage of delirium or excitement, that is there is loss of consciousness. ठीक है, पेशेंट की कॉन्शियसनेस लॉस हो गए till the beginning of regular respiration. ठीक है, जब तक पेशेंट की रेगुलर रेस्पिरेशन ना आ जाए. और इसमें 2 चीजें और याद रखनी है. दैट इज इन द स्टेज 2 देयर इज रोविंग ऑफ द आई बॉल ऐसे मूव रोव करने लगेगी, प्यूपिलरी का partial dilation हो जाएगा. एंड रिमेंबर द फर्स्ट रिफ्लेक्स टू बी लॉस्ट इज द eyelash reflex. Remember, this is the question asked. The first reflex, सबसे पहला reflex to be lost is the eyelash reflex. Then the stage 3 of the Goodall is the stage of surgical anesthesia. ठीक है, जिसके बाद सर्जरी परफॉर्म हम कर सकते. दैट इज स्टेज 3. दैट इज बिगनिंग ऑफ द रेगुलर रेस्पिरेशन टिल सिजेशन ऑफ द स्पॉन्टेनियस रेस्पिरेशन. ठीक है, दैट इज स्टेज 3. सो बिगनिंग ऑफ रेगुलर रेस्पिरेशन टिल सिजेशन ऑफ स्पॉन्टेनियस रेस्पिरेशन, and it is in this stage that most of the surgeries are done, and stage 3 is in turn divided into 4 planes. ठीक है, तो plane 3 of stage 3 is the one which is providing the surgical anesthesia and where the surgery is done. And stage 4, we should not go to stage 4 because that is a stage of medullary paralysis. Is it clear? So these are the stages of anesthesia, the 4 stages of anesthesia which were described by Goodall. Is it clear? Now coming to the 6th question, which group of fibers is least susceptible to local anesthetics? A alpha, B beta, C B, or D C? What should be the answer for this? Which group of fibers is least susceptible to local anesthetic? Least susceptible, it is asked. Dr. Kunal, Dr. Khushi, what should be the answer for this? Which group of fibers is least susceptible to local anesthetics? What should be the answer for this? A alpha, A beta, B fibers, or the C fibers? What should be the answer for this? Okay, so the answer is A alpha. The least susceptible fibers to the local anesthetics are the large myelinated A alpha fibers. No, Dr. Kunal, I am asking least susceptible. Dr. Kunal has given me C. No, it is not C fibers, it is A alpha fibers, which are the motor fibers. Okay, which are the motor fibers? These are the least susceptible. Remember, it is B, C, A. ठीक है, it is BCA. The B fibers, these are most susceptible, C fibers are less susceptible, and A fibers are least susceptible. So remember like this, classification of the nerve fibers according to Erlanger and Gasser. ठीक है, to okay, these are the classification. So type A fibers, remember like this, whenever अगर क्वेश्चन पूछा जाए लीस्ट ससेप्टेबल, ऐसे भी याद रख सकते हैं, ए अल्फा इज द वन विच इज कैरिंग द मोटर फाइबर्स. जब भी हम स्पाइनल एनेस्थीसिया देते हैं तो पेशेंट को पैर उठाने के लिए कहते हैं, दैट इज वी आर इंस्पेक्टिंग द मोटर कॉम्पोनेंट एंड वी एज्यूम कि अगर उसका मोटर कॉम्पोनेंट चला गया है, दैट मीन्स द अदर कॉम्पोनेंट्स, द सेंसरी एंड द ऑटोनॉमिक कॉम्पोनेंट इज ऑल्सो गॉन, बिकॉज द मोटर कॉम्पोनेंट इज द लास्ट वन टू बी गॉन, क्योंकि जो ए अल्फा फाइबर्स होते हैं दे आर लीस्ट ससेप्टेबल. ओके, सो type A fibers are the A alpha fibers, that is motor and proprioception, that carries the motor and proprioception. These are large myelinated fibers, A fibers. ठीक है, A beta, तो A alpha motor, A beta is touch and pressure, it is for the touch and pressure. A gamma is for the muscle spindle, ठीक है, it is for the muscle spindle, and A delta is for the pain and temperature. Is it clear? A alpha is motor and proprioception, A beta is touch and pressure, A gamma, that is the muscle spindle fibers, A delta is the pain and temperature. जो B fibers हैं, these are most susceptible, these are they carry preganglionic autonomic fibers, and the C fibers, okay, these are small non-myelinated and they carry pain, temperature and postganglionic sympathetic fibers. So the order of susceptibility is B, which is preganglionic autonomic, more than C, which carries what? The sensory stimulus, than A, that is A delta, more than A beta, more than A alpha. Okay, so it is BCA, it is BCA, remember this. Okay, I am asking you in A also it is, sorry, A alpha, okay, it is BCA, Dr. Kunal, there is some confusion. Okay, so it is B, C and then A, that is motor and proprioception. For sure, the A alpha fibers which carry the motor fibers, these are the ones which are least susceptible to local anesthetic. Yeah, it is a very controversial question, but you see, Dr. Kunal is telling that it's a very controversial question, but you see the A alpha fibers, ठीक है, they carry the motor fibers, और इसलिए हम लोग स्पाइनल एनेस्थीसिया में हर समय जब भी देते हैं उसका इफेक्ट देखने के लिए पेशेंट को क्या बोलते हैं, अपने पैर उठा के दिखाओ. Why? Because we are seeing the motor component of it, we are seeing the motor component of it. और अगर वो आ गया है तो हम लोग क्या देखते हैं कि हर समय उसका पेन, टेम्परेचर, टच, प्रेशर और ऑटोनॉमिक फीचर्स चले गए, right? So therefore the answer should be A, that is A alpha. Okay, so sensitivity of the nerve fibers, order of blockade, as I told you, it is BCA. Okay, BCA, and order of block, first the autonomic senses are gone, then the sensory, and then the motor component is gone, and then the motor component is gone. So out of these it should be A alpha, it should be A alpha. ठीक है, and amongst the sensory, see, sensory may be temperature, that is cold before heat, so this is also carrying temperature, ठीक है, and C is also carrying temperature. तो इसलिए हो सकता है there is some confusion, but the A alpha fibers, ठीक है, these are the ones which are least sensitive. Okay, so temperature, cold before heat, then pain, touch, and then deep pressure. This is how amongst the sensory blockade it is gone. ठीक है. So what is differential blockade? From this only, because of the sensitivity of different nerve fibers to the local anesthetics. Okay, sensitivity of different nerve fibers to the local anesthetics. Now this is what causes the differential block. Okay, so it refers to the clinical phenomena that the nerve fibers with different functions have different sensitivities to local anesthetic block. ठीक है. The sympathetic block is highest. Okay, because it is the most susceptible. तो अगर dermatomal level T10 पे अगर मोटर कंपोनेंट गया है तो उससे 2 लेवल ऊपर सेंसरी जाएगा और उससे 2 लेवल ऊपर ऑटोनॉमिक जाएगा, एंड दैट इज नोन एज डिफरेंशियल ब्लॉक. Dr. Kunal, is it clear? Okay, so this is the differential block. The sympathetic block is the highest than the sensory, which is in turn is higher than the motor blockade. So this is what is differential block, and this we see in spinal anesthesia, and this we see in spinal anesthesia. Is it clear? Is it clear? Now, coming to question number 7. Question number 7, highest concentration of oxygen is delivered through A. nasal cannula, B. venturi mask, C. bag and mask, or D. face mask and reservoir. What is the highest concentration of oxygen? It is delivered to A. nasal cannula, B. venturi mask, C. bag and mask, or D. face mask and reservoir. What should be the answer for this? Please read the question carefully and answer. I'm waiting for the answer. Highest concentration of oxygen is delivered through. Okay. See, this is the question about the oxygen delivery devices. Okay, oxygen delivery devices, and remember, I'll just tell you the oxygen delivery devices, these are in turn divided into 2 types, that is, okay, so oxygen delivery devices, these are in turn divided into the low flow, that is variable performance equipment, and high flow or fixed performance. Okay, fixed performance. So the oxygen delivery devices, these are in turn divided into the variable performance and the fixed performance equipment. Now what is variable and what is low flow? Before that, I'll just tell you the answer. The answer is face mask and with reservoir, and reservoir, I'll just tell you how. Okay, what is low flow or the variable performance equipment? In this, the oxygen is supplied at a fixed flow. Okay, oxygen तो हम लोग at a fixed flow like 4 liter per minute, for example 4 liter per minute में हम लोगों ने oxygen को दिया, but it is only a portion of inspired gases. It is only a portion of inspired gases, and it does not meet all the inspiratory flow demands of the patient. ठीक है, Dr. Kunal has given B, that is venturi mask. It is not venturi mask. Venturi mask में सिर्फ 0.6 जाता है, face mask and reservoir में 0.8 तक जाता है, and therefore the answer is D. I'll tell you how. ठीक है, so oxygen delivery devices, low flow equipment में क्या है, the oxygen is supplied at a fixed flow, that is only a portion of the inspired gases, and it does not meet all the inspiratory flow demands to the patient. Okay, the performance of these devices are affected by the patient's change in the tidal volume and respiratory rate, that is, the performance is variable, and therefore the FiO2 cannot be predicted. The FiO2 cannot be predicted. The example of these oxygen delivery devices are जैसे nasal cannula है. Nasal cannula में हमने for example 2 liters per minute पे खोल दिया, तो उसका ऑक्सीजन सप्लाई जो है वो तो फिक्स्ड फ्लो पे है, मगर वो 2 liters per minute इज नॉट एबल टू meet the full demand, oxygen demand of the patient. और पेशेंट कितना रेस्पिरेटरी रेट और टाइडल वॉल्यूम लेता है उसके हिसाब से FiO2 इज जनरेटेड, उसके हिसाब से FiO2. सो इट इज वेरिएबल, it depends upon the patient. An example is nasal cannula. It can deliver up to 0.24 to 0.44 FiO2 at a flow rate from 1 to 6 liter per minute. ठीक है. सिंपल फेस मास्क, ये जो सिंपल फेस मास्क है, इट इज ऑल्सो नोन एज हडसन मास्क. ओके, इसमें ये भी वेरिएबल है, ये भी वेरिएबल है. द FiO2 is 0.4 to 0.6 at a flow rate of 5 to 8 liter per minute. That is the simple face mask. So nasal cannula, simple face mask और non-rebreathing mask. ठीक है, दिस इज अ नॉन रीब्रीदिंग मास्क, दैट इज अ फेस मास्क विद अ रिजर्वायर. तो इसमें क्या होता है कि रिजर्वायर बैग में एयर एक्यूमुलेट होती रहती है एंड द पेशेंट कैन इसमें जैसे जो सप्लाई हो रहा है, इट इज नॉन रीब्रीदिंग बिकॉज देर इज वॉल्व, देर इज अ वेंट विच इज प्रेजेंट, और जिसमें से एक्सेल एयर बाद में बाहर चली जाती है इनटू द एटमॉस्फेयर एंड पेशेंट हैज अ रिजर्वायर बैग. सो दिस इज नॉन रीब्रीदिंग मास्क. रिमेंबर, अगर यहाँ पे वेंट है सो इट इज अ नॉन रीब्रीदिंग मास्क, फेस मास्क विद अ रिजर्वायर. और इसके अंदर FiO2 इज 0.80, which is the maximum oxygen concentration which is supplied. Okay, so it is a face mask with a reservoir which is a non-rebreathing mask. Now fixed performance में क्या होता है? It provides complete source of inspired oxygen. Complete source of inspired oxygen is supplied by fixed performance. ठीक है, and the performance is not affected by change in the respiratory rate. It delivers accurate FiO2. That is fixed performance. This and इसका example है Venturi mask. और Venturi mask में 0.6 is the highest. ठीक है, जबकि face mask with reservoir में क्या था? It was 0.8. What is Venturi mask? It works on the Venturi effect, which is based on the Bernoulli principle. ठीक है, ये जो color coding है, these color coding है, it supplies different FiO2. ठीक है, it supplies different FiO2. So it is based on Bernoulli principle, which is relationship between the velocity and pressure exerted by moving liquid. ठीक है, यहाँ से ऑक्सीजन सप्लाई जाएगा एंड डिपेंडिंग अपॉन यहाँ पे कौन सा ये है, कितना कंस्ट्रिक्शन है, डिपेंडिंग अपॉन दैट इट विल सप्लाई द वेलोसिटी एंड द प्रेशर. ठीक है, अब यहाँ पे अगर एरिया कम होगा तो क्या होगा? वेलोसिटी इंक्रीज होगी, और एरिया ज्यादा होगा तो वेलोसिटी कम होगी, एंड डिपेंडिंग अपॉन द कंस्ट्रक्शन डिफरेंट FiO2 is being delivered. So that is Venturi mask. Is it clear? So this is fixed mask. Other examples are air entrapment nebulizer and back-end mask ventilation. Back-end mask ventilation का example है AMBU. It is AMBU, that is artificial manual breathing unit. Is it clear? I think there is some lag because it is raining over here. There are some net issues. Is it lag? Dr. Kunal, just let me know. Is the video proper, or is there any lag? If there is any lag, I'll just continue in the next class. I think there is some problem with the net because it's raining over here, so there might be some problem with the net. Is it clear? So the back-end mask ventilation, the example this is